Hey everybody, it's Ricky. I am a residency trained clinical pharmacy specialist, and I want to jump on today, talk a little bit about expectations, responsibilities, and tips and tricks for PGY1 Pharmacy Residency. I thought this was a important topic to talk about because the new residency year is starting on July 1st. And looking at the match statistics, about 80% of people actually matched into PGY1s this year, which was up from about 60% in 2020 when I was going through this. And so a lot more people are kind of starting on this journey. And so I thought it'd be good to talk about, what to expect and how to get through it. So this video will obviously be really good for prospective PGY1s, also for third and fourth year pharmacy students who are just dipping their toes into the water and seeing if residency is right for them. I will only be talking about, what to expect during your residency year. So things such as applications, letters of intent, letters of recommendation, and the matching website through ASHP will be discussed on a future video. So before we get into the specifics, I just wanted to highlight the different types of PGY1 pharmacy residencies for those interested. The traditional type of PGY1 pharmacy residency is in a hospital setting where you're exposed to a variety of different disease states and patient populations. You can do a second year of pharmacy residency or a PGY2 where you specialize in a specific disease state. So for me, that was cardiology. I learned all about the heart for 1 year. There are also PGY1 programs in the community setting, as well as managed care. And there's also combined PGY1, PGY2 programs, which happen over 2 years. And those can be in things like pharmacotherapy, informatics, or health system administration and leadership. But again, I'll be focusing on the traditional PGY1 in a hospital setting. So there is a lot we can talk about, but in order to keep this video pretty brief, I just want to talk about 5 kind of key components that you'll probably run into during your PGY1 year, that being patient care, research, pharmacy and therapeutics-based activities, professional development, and teaching. So when it comes to patient care, this is something that you'll be doing just about every day of your residency. You'll be assigned to different services for a variety of time, usually about, 4 to 5 weeks. And these experiences can be in a wide variety of different areas. This can be internal medicine, cardiology, oncology, anticoagulation clinics, outpatient, pediatrics, a variety of intensive care units, the emergency department, so on and so forth. And the whole goal and reason for doing this is to increase your exposure and to help you better learn and understand how to identify and treat disease states really across the entire scope of human anatomy. So when it comes to patient care, my biggest tip for you guys is you are going to be talking about a lot of primary literature. So mainly clinical trials. You'll be talking about a lot of treatment guidelines through national organizations. And it's one thing to talk about them and try to remember what your preceptor said, but it's another to be able to pull up that information and access it at any time. And so I strongly recommend really your first day of residency or your first month to build a literature repository on your desktop or laptop and organize folders based on disease state. So for example, I have a folder entitled Acute Coronary Syndromes. And anytime I want to review data or primary literature surrounding certain medications, I can just go into that folder, find what I need, and review it. And to this day, I still use the same folders I created during my PGY1. So definitely would recommend that as you get into your patient care aspect. Another thing you'll be going through during your PGY1 is research. And by research, this is typically an institutional review board or IRB approved project. The topic is either selected for you before you even start, or your program will allow you to select the topic. And the whole goal is to just introduce you to the research process. So how to identify a topic, how to identify data to actually collect, how to collect that data in an efficient manner, how to analyze the data statistically, and then how to put together a manuscript and present your findings. And so, as you can tell, this is a lot to do in 1 year. Oftentimes research is conducted over a much longer period of time. And so my tip for research is to start data collection really as early as you can and to break it up into more manageable daily chunks. And so what I mean by that is, say you have to collect data on 200 patients and you have 1 month to do it. I will break that up into the number of working days. So assuming 5 days a week, 4 weeks in a month, that's 20 days to collect on 200 patients, or about 10 patients per day. And I think when you think about it as, oh, just 10 patients per day, it makes that goal much more achievable. I would also recommend actually putting a research data collection time on your calendar and kind of blocking that out so that people don't inadvertently schedule meetings for other projects or other conversations during that time when you would otherwise be, in the zone data collecting. Next, when we talk about pharmacy and therapeutic projects, these are, kind of variable based on where you are practicing for your PGY1. These can be things like drug monographs, drug class reviews, or medication use evaluations. And, typically the whole idea is that the pharmacy and therapeutics committee associated with your hospital, wants to follow up on how you are using either a high cost or high risk medication. So, for example, I did a drug class review on direct oral anticoagulants. So my tip for pharmacy and therapeutics committee projects, they're a little less intense and hopefully less time intensive than the research project. But because of that, it's actually a really good opportunity to get students involved. And so if you have the opportunity to get a student on board to help with writing a manuscript or reviewing a drug class review or even collecting some of your data, I would definitely encourage you to speak up and reach out to your preceptors and see if they're okay with that. Not only will it help you get that project on, hopefully in a more time efficient manner, but it gives you a good opportunity to practice your precepting skills and your project supervision skills as well. Key thing you'll be doing a lot of during your PGY1 year is professional development. And this really kind of depends on what program you're at. So for example, my program for their PGY1s put on about 10 to 20 professional development seminars for the residents and fellows to attend on a variety of topics such as financial considerations for pharmacists, how to write effective evaluations, and a variety of presentations on diversity, equity, and inclusion. Now, say your program doesn't have something like that, you'll still be meeting with your residency program director and coordinator every quarter and upon your starting your residency. And that's a really great opportunity to identify any goals that you have. And so my tip when it comes to professional development is don't be afraid to come in with, non-pharmacy related goals or goals outside of patient care. So things like improving your work-life balance. A lot of programs, want you to succeed. They match with you because they want to see your development. And these programs have a really large network of alumni that can usually help you achieve all of those, pharmacy related and non-pharmacy related goals that you have. So don't be afraid to speak up and, address everything that is encompassing your life during your residency year. And finally, with teaching, you'll be doing a lot of this throughout your residency year. You can be doing teaching in the classroom, you can be doing teaching in a laboratory setting, and you'll be doing a lot of teaching on rounds during specific preceptorship-based rotations, where you, in essence, kind of act as the primary preceptor, and then the student is with you, and you can teach them everything that you've learned on this rotation and throughout your residency year. One thing I would recommend is during your PGY1, if you are offered a teaching certificate program, I would recommend that you complete it. The reason for that is that what you learn and the skills you develop during your PGY1 can definitely be applicable to either a PGY2 or your clinical specialist job once you get out into the real world. Secondly, by getting it done during your PGY1, you probably will not have to do another one during your PGY2, and this will allow you to focus a lot more on learning that specific disease state during your PGY2 year. So I know we talked about a lot of things. I tried to keep it as condensed as I could. And so to summarize, there's really, 3 key things I want you to take away. Number one, remember that the PGY1 year is all about learning. A lot of people made the reference to me that residents during PGY1s are like a sponge. They're very porous and they absorb everything that is said to them. So you will learn a lot of new things. You will ask a lot of questions, and that's really encouraged and perfectly acceptable. Again, don't forget to make that literature repository so that you can access all that good information down the road. Secondly, I encourage you to begin work on your longitudinal projects as early as you can. Establish reasonable daily goals, and don't be afraid to leverage students and have them involved on your projects if that's something that your program offers. Finally, please remember that programs match with you because they want to see you succeed and grow as a pharmacist. And so don't be afraid to incorporate work-life balance and other non-pharmacy based interventions into your quarterly evaluation plan so that when you leave residency, you're a better person and clinician than when you started. I want to thank you for taking the time to watch this video, and I hope you learned something useful. If you enjoyed this type of content, please feel free to leave a like, subscribe, and leave a comment if you have any questions or thoughts about what we talked about in the video today. That's all for now, and I'll see you guys soon. Have a nice day. Bye-bye.